so I'm going to be sharing my screen in just a bit. That's going to go over the guidelines that we have in place for this summer for day camp. We just received our guidelines from the state just a few weeks ago that highlighted day camp and overnight camp programming. So you're going to see some of the changes in tonight's presentation. However, do keep in mind that changes are coming on a regular basis, and we will continue to monitor and update the guidelines as changes come about, and we will update parents and guardians of those changes when we receive them. If you have questions, please put it in the chat. We're going to be opening up after the presentation for questions and answers. The presentation should take about 15-20 minutes, and then we're going to open it up for questions. Okay. So I'm going to share my screen so that we can get started on the presentation. Okay. All right, so can everybody see that? I'm hoping.
Yes, Janet, we can see it.
Okay, great. So I'm going to go into the full view, so I'm not going to be able to see anybody. So, so if there's something comes up, just let me know.
Now we lost it because now only we see your dog.
Okay.
I don't think you can go full view. I don't think you can go full view. I think you need to leave it where it was.
Okay.
We can see it fine.
All right, let me end it then. My apologies. All right.
It was actually the perfect size before you went full view.
Okay, well, let's try this again. Okay, is that better?
Yeah, that's okay. We can see it.
Okay, perfect. Okay. Okay, so some of this you're going to be familiar with. These are some of the modifications that we initially talked about at the beginning of the season, how we reduced our camp numbers. We've created a communicable disease plan. We're going to be using small groups. And you're going to find all of this information on our website, including the recorded presentation for tonight. So there's certain things that we're asking families to do prior to arriving at day camp. We would like you to try and limit your travel for at least 2 weeks prior to arriving at camp. You will be required to complete the COVID-19 pre-screening health form, which is located on CampDoc as part of your camper profile. When you go on to CampDoc, you'll see register, you'll see camper profile, you'll see account, and then you should see pre-screening. That's where you're going to fill out the pre-screening information. You need to fill this out for 5 days, every day for 5 days leading up to your daughter's arrival at camp. So if she's going session 1, which starts July 5th, you're going to want to do it that last week of June in order to comply with the guidelines. Okay. Per New York State Health, children that have received their COVID-19 vaccination must have their vaccination card uploaded into CampDoc. Now you'll find this again in your daughter's camper profile. Look for the immunizations tab. Click on that. You'll have to upload her regular immunization records. And then at the very bottom of that, you'll see COVID-19. And you'll have to upload the card there. New York State is requiring camps to collect proof of vaccination for all campers and staff. So therefore, if your daughter is vaccinated, which vaccinations are for 12 and up now, then you need to please provide the COVID-19 vaccine card. And again, if your child is exhibiting any COVID-19 symptoms prior to her arrival at camp, then she is not allowed to attend camp unless she has a clearance from her doctor with a negative COVID test. Okay, drop-off procedures for day camp. Okay, when you arrive at camp, you're going to be directed by the staff to the parking lot. They were asking you to remain in your vehicle. We say in or stand if you want to say goodbye to your child. But that's as far as parents will be allowed to enter. You will not be allowed to escort them into main camp this year. That's our way of trying to control social distancing and trying to combat COVID. At that time, our health assistant or nurse will come over to your car, take your daughter's temperature, and ask the required pre-screening health questions and collect any medication. Once your child is cleared, she will then be escorted from the vehicle to her unit in main camp, where she'll be with her pod. Okay. If there's any other additional information or paperwork that's needed, a staff member will come to the vehicle and provide or collect that and or provide that. Now, this process will occur every morning at day camp. Okay. MB and Linda, anything you want to add to that?
No, just that if you're not dropping off at camp for Piperwood, if you're riding the bus, that pre-screening will take place before your child gets on the bus.
Yeah. Linda, anything on your end?
No, I think we're good.
Okay. All right, so to MB's point, if your daughter is taking the bus, you will go to your child's bus stop location that you indicated in part of your registration. Again, you will remain in your vehicle or stand next to your vehicle. Once the bus is there, the bus aide, the staff bus aide will get off the bus, come to the car, and do the health screening there at your vehicle. We ask that you please do not leave your child unattended until she has been cleared by our staff bus aide. Once your child is cleared, then she will be escorted to the bus where she will have an assigned seat. And that seat will be hers for the remainder of the week. If there are siblings that are going together, then they will be able to sit together on the bus. And again, this process will take place every morning at the bus stop location. Okay, pickup procedures. Again, we're asking families to remain in your vehicle and follow the directions given by camp staff. The pickup procedures are going to look slightly different. Okay, you'll be given the directions by staff. You wait in your car. You may have to wait at the lodge circle until bus is clear. That's for Piperwood. And this also applies to campers that are participating in aftercare. Okay. Remember, you will need photo identification in order to release campers. Okay. And that will release campers only to those that are identified on the pickup form. So please don't forget yourself and make sure you're adding everybody that you authorize to pick your child up. And a staff member will escort your child to your vehicle, will check identification, and then she'll be free to leave at that point. Okay. MB and Linda, anything you want to add regarding pickup procedures?
Our goal is to have the pickup in the parking lot as we did, but keeping people in their cars, kind of making cars live through. Again, it's going to be a trial by error, so we have a plan. We have to see how it goes in that first week and then make adjustments, but parents will stay in their cars and we will bring the girls to you. Yes.
Okay, and for me, if you're familiar with Windy, it's not a very wide parking lot area, and the parking lot actually goes right up to the road. So I'm more looking at having a traffic circle so that they'll come and they'll pull, but you can't pass people. So we'll take care of the first car in line as they go. And for pickup, we color code our girls. So we'll color code your windows. So when they pick up, the adult can see that somebody pink belongs in your car. So the pink adult will escort over. It'll make it go a little bit faster. So we'll have those processes into place and you'll pick up on it real fast. But I think circling around and staying in order is the best way for Windy because it's a narrow area. We don't want cars backing out. We'll have 1,000 fender benders if we do that.
Right. Thank you, ladies. So pick up for bus procedures. Again, you're going to go to your designated bus stop location. You will remain in your vehicle. Please do not walk to the bus. Okay, again, please remain in your vehicle. You will show photo ID and a staff bus aide will escort your child to your vehicle and release her once she clears the camper pickup form. Okay, masks. So I will say that we are aware of recent updates with masks, and we are meeting next week to discuss further protocol as far as what our masks mandates will be this summer. And once that has been determined, we will update you at that time. I will tell you that if masks will be required, the health department has stated that bandanas, buffs, and face shields are not acceptable face coverings for staff and campers to wear while at camp. If we are requiring masks, as I said, we will have extra masks on hand if need be. Again, we will update you more next week once we have had a chance to review the updated guidelines and made our decision. Okay, hygiene, cleaning, and disinfection. So we have, each camp will have hand washing stations and signage throughout camp this summer. And staff will work with our campers on assuring that they are washing hands on a regular basis. We also have hand sanitizer located throughout the entire property, all of the pods, the units, the activity areas, and the lodges will have hand sanitizer available. We'll also have a cleaning schedule on a regular basis going through, making sure all buildings, restrooms, activity areas, lodges, etc., are cleaned on a regular basis and notated. Okay. We are asking, per New York State Health, to reduce the risk of exposure and sharing of personal items. Please do not have your child bring any of her favorite toys or stuffed animals to camp. We know how kids like to share, and normally in a non-COVID year, we would be very open and receptive to that. However, this year it's very challenging to try and mitigate this spread. So we want to make sure that we're trying to reduce that. So please don't have them bring any of their toys or favorite stuffed animals. Social distancing in pods. So as indicated earlier on in the year, our groups are going to be traveling in small pods or cohorts of 5 to 10 campers with 2 to 3 staff. These groups will remain together the entire time they're at camp, and they will travel together as a group. They'll do everything together as a group. They'll have lunch, they'll go to activities. They will never separate while they're at camp. Again, campers taking the bus will be seated one child every other seat unless traveling with a sibling. Okay. All right. MB and Orlinda, anything you want to add to this at all?
And just an update on the busing. I believe it's one child per seat now for the bus in terms of the busing, but that's something we will check with the bus company again. But I do believe it's gone to 1 per seat.
Okay.
But they're individualized.
Yeah. We'll definitely reconfirm with our bus company. But yes, thank you, MB, for the update. All right, so our day-to-day procedures, what does this look like? So again, small groups, we're going to be cleaning our buildings on a regular basis. We're going to be practicing social distancing. We'll have hand washing stations in designated areas throughout camp. There will also be a hand washing station and porta pot in the parking lots. So if families need to use the facilities, they will be able to do that right in the parking lot. Daily health screening. So again, as I said, campers and staff will be screened daily, either in the camping parking lot or a designated bus stop. Again, anyone exhibiting signs and or symptoms on the morning of the health screen will not be allowed to either enter the bus or stay at camp. And then you will be directed to contact your family physician for further care. Okay. So if you have a camper that displays signs and symptoms during the day, what will happen is they are put in a designated isolation area with supervision, and the parent guardian will be contacted to make arrangements to pick your child up. Not only do we contact you, but we contact our family physician, as well as the New York State Health Department. You, a parent guardian, we're asking that you contact your family physician for a COVID-19 test, and you notify us of the results, because we are required to report those results to the health department. So again, this is coming right from New York State. In the event that you, the parent guardian, or other household member of the child or camper attending day camp must be isolated because you have tested positive for or exhibited symptoms of COVID, you, the parent guardian, or other household member are not allowed to enter the camp property for any reason, including picking up your child, and other arrangements must be made. Okay, so it goes on to state that, again, if you're exhibiting signs and symptoms and have been tested and it is positive for the virus, then again, you have to have an alternative parent guardian or your emergency contact authorized by you must pick up your child. As a close contact, then your child is not allowed to return to camp for the duration of the quarantine. And then we ask that you please contact camp if they are to return for another week of camp, as we would have to get permission from the health department. The third scenario, again, if a parent guardian or another member of the household is under quarantine order from the local health department without symptoms or a positive test, they must utilize an alternative parent guardian or emergency contact. However, this time, as a contact of a contact, your child may return to camp during the duration of the quarantine. Okay. And then the final scenario is if a camper or their household member becomes symptomatic, for COVID-19 and are test positive, the child must quarantine in accordance with the local health department guidance and may not return or attend the camp program until the quarantine period is complete. Okay. And then if your child exhibits signs and symptoms after the camp session is over and test positive, you are to notify the camp immediately, because we then must notify the health department and then notify those families of the pod that your child was in. So again, we talked about a lot of COVID guidelines and what does that mean for our programs in camp, what will take place and what will the modifications look like. So the goal is a physically distanced activity is not to replicate a non-physically distanced activity, but rather to replicate the outcome of that activity. In other words, we are looking to provide as many of the traditional camp activities as we can and will, just with modifications. So one of the things that we're going to be training our staff in during staff week is we're going to be asking these questions, which is a lot of things that we ask regarding risk management. You know, place participants in a close proximity involving singing, shouting, or chanting. Will be shared resources? Will it take place outside? Will it be indoors? Will there be ventilation, etc.? And then if they are able to answer yes to a lot of these, then with the modifications, the activity can take place. So again, you know, some parents are asked, well, what type of programs, you know, will be done knowing with all these COVID guidelines? And this is just a sampling of some of the things that actually can be done at camp with some modifications in place. Now, keep in mind, you know, we're going to have pods. So a lot of the pods are going to be social distancing from other pods. So these pods can be able to work on these activities together in their small group. Long as, you know, we're disinfecting after each use, we're putting some type of physical barrier in between if need be. And this is a really good example of girls that could be participating in the ropes course. So this is an example of one of the low elements where typically the two people holding the pole would be really up close with their hands up and as a brace in case the participant would lean one way or the other. In this instance, one of the ways of modifying this, as you can see, is providing a long PVC pipe where the participant holds on and the other two on each end are holding it to balance. So again, the activity can still take place. It's just with modifications added to it. Okay, so that ends our presentation. And so I guess I'm going to open it up now to anybody that has questions.
And there was one in the chat, and I had responded early on just that it would be answered, and I think it was. The question had been, will campers and staff have to have a negative COVID test or proof of vaccination before they're allowed to attend? And I believe staff, we don't have to have a COVID test, okay? We do need to know if people are vaccinated, but the testing isn't required for day camp. And then what is the mask policy, which I think we also discussed.
Right.
I did have a question on the COVID test, because my son is going to Boy Scout camp and they're saying per New York State guidelines, I have to get him tested for a COVID test. That I talked to them today and they said that they can't not, according to New York State, run their camp unless every person on property either provides proof of vaccination or has a COVID test 3 days before setting foot on camp. And they keep referring it back to New York State guidelines. It's the law. We're being told we have to do that in order to open. It's all camps everywhere.
It is true. It is true for resident camps.
He's going to a day camp.
It is true for resident camps, but the guidelines,
Day camps?
not as we
That's
read the
not what I'm
guidelines,
getting from
no.
them. Okay, because they're saying it's for their day camp too. And they're saying it's because of the law, but if it's not the law, then that's good to know too.
Right. No, it's our
So it's not?
understanding. It is our understanding that it is for resident camp only.
Okay, then I will have to check with them again tomorrow then, because they're saying it's both. I had another question on how you said on Camp Doc we have to go in 5 days ahead of time and fill out the questionnaire.
Yes,
So will
every
Camp
day
Doc
for
will-
5 days.
So Camp Doc will open back up then, because usually it like locks.
Yes. Yes.
Okay, and I think that's it.
I just wanted to add to the day camp piece too about the testing. You know, I think one of the pieces that we're not seeing that as a requirement through New York State too is because, you know, they're leaving every single day, right? With resident camp, they're staying there, so it would make sense. So I would just be curious. So with the
That's what I said.
with the Boy Scout camp, are you having to test like several times a week or like?
Nope, they said within 3 days, of your first day at camp. And I was like, well, that kind of doesn't make sense because they're coming home every night. He goes, yeah,
Right.
we agree with you. We don't want to do it, but the state is telling us we have to. So they keep pushing it back, saying that they're being forced to by the state. So
Okay.
I don't know if
It-
they just don't know what they're talking about.
Interesting.
It
Okay.
is interesting, and this is a day camp, Carolyn?
Yeah,
Yeah.
it's just, that's why everything's so confusing. 'Cause
Yeah.
you get different things from everywhere, so.
Yeah, I can see where that would be confusing.
It is interesting that the guidelines themselves are a little, I will say, just a little fuzzy, just because the way it's set up, it's like there's like just a small note on one of the pages later that's like, and all of this only applies to resident camp. So they're all kind of together in the same
Yeah.
document. So
Well,
there's kind of confusion there too.
maybe hopefully they're wrong and they'll change it so that.
Yeah.
If he doesn't want to do it. So my son doesn't want to do the test and I don't want to make him do the test. So
Right, yeah.
that'll be good.
Yeah, because where it talks about the COVID testing, to Karen's point, it's part of the resident camp section.
Right, that
And-
makes sense because they're sleeping there and they're spending,
Right,
they're
right.
not
There's
leaving.
there's nothing mentioned about COVID testing prior to the resident camp section.
Yeah, I don't know. Who knows what they're thinking.
Well, the only thing I want to add is, since the beginning of this whole situation, Girl Scouts has been very thorough and very open, and we always know what to expect. And I respect them a lot for that. So I think that in our organization, I think it's fair to say that you should just trust the people that are making the decisions, because they've been spot on all along.
Oh yeah, I think you're right. And I'm hoping me going back to Cubs, Boy Scouts and saying, well, look, this is what's happening. And hopefully they'll change their tune too.
Yeah,
Right.
and
Because I don't
Yep.
want to subject my poor little 9-year-old who has no symptoms to COVID test.
but you'll see with both organizations, one's going to give one and one's going to give the other,
Yeah.
you know, as far as how they're enforcing things. But I'm just saying that Girl Scouts has been spot on. And you know, our mask policy is a little bit more stringent right at this point than the state, but we're
That's
also
good.
mentoring children that are under 12 that can't get vaccines. So
Absolutely.
they're making sound decisions. So
Yep.
from our
I
end,
agree.
I think you should be trusting.
Yep.
MB, Jennifer had a question on what will the drop-off times for Camp Piperwood be?
Sorry, I had to unmute. We will start in the park on Mondays. We start by 8:15, and then the other days it'll be 8:30. But then we will be there for drop off to start. So that will give us some more time to bring people in. Okay, so Mondays will be 8:15, and the other days will be 8:30.
And I don't recognize any names from Wendy, but if anybody's here from Wendy, I'm more than happy for you to come a little early and pick up a little late, because I don't want all the cars to show up at the same time. So,
I mean, our morning care will still start at 8 o'clock, be
Yeah.
open by 8, so that happens there, so.
same here. So if anyone hears from Wendy, feel free to come a few minutes early, feel free to pick up a few minutes late, because I will be there. And that just reduces the congestion.
Are there any other questions? It's such a small group, so you can unmute if you have a question. Okay, so, well, thank you so much, everybody, for attending tonight's presentation. Like I said, this presentation is recorded and will be on the website for those that could not make it. All the information that we talked about tonight is on our website under the COVID guidelines. And we will continue to update all of you as changes come our way regarding COVID guidelines. And once again, as I said, once we make our final decision on our masks, we will update all of you at that time. So, thank you again, thank you, and have a great evening.